Thank you.
There we go.
Hi, my name is Marianne, and I'm the Training and Engagement Coordinator for Toronto Drop-In Network. I would like to talk about the importance of increasing drop-in funding, specifically wage parity for frontline workers. Last year, we worked with a graduate student group through U of T Monk's School of Global Affairs and Public Policy. The research topic was wage parity, working conditions, and retention in Toronto drop-ins, a study supporting TDIN's living wage advocacy. Their findings indicated that the average income for a frontline worker in the drop-in is $26.63. That's not very much. It is $932.05 a week before taxes and $680 a week after taxes. The average cost for a one-bedroom apartment in Toronto is about $1,715 a month, and as you can see, these numbers are quite problematic. The main workplace challenges that were cited were insufficient salary, high work pressure, lack of resources, and limited time capacity and understaffing. Typical drop-in responsibilities are crisis intervention, day-to-day operations, case management, service coordination, food service, distribution of essential items like clothing and hygiene products, program facilitation, and of course, added to this is overdose response and CPR. $26.63 does not line up with adequate compensation for this level of expertise and skills. Drop-ins provide an essential service and are life-saving hubs for those who are unhoused, precariously housed, living with mental health and/or substance use issues. They are a place where people can get food, resources, and safety. They are a place for social connection and for those who are isolated. They're a place where people can be seen and feel a sense of belonging. The staff that work in these drop-ins provide a vital connection where relationships and trust are built. We are in the midst of a housing crisis, a food insecurity crisis, a drug poisoning crisis. Government policies from all levels of government that affect members of this sector fall on drop-ins. As we advocate for better funding and reforms, we are often met with government officials redirecting us to other levels of government and shifting responsibility. This was actually quite apparent over the holidays when public health reported 35% increase in overdose calls to Toronto paramedic services. It's a perfect example of a provincial policy, like closing the safe consumption sites, falling on municipal programs like paramedic services. Drop-ins have also significantly increased their overdose response services since March, and yet the funding for drop-ins continues to be insufficient and inadequate for the increasing demand on services. In 2020, during COVID, the city recognized that drop-ins were actually an essential service. Frontline workers were given an incentive of an extra $4 an hour for 16 weeks. This was only a temporary measure to ensure that drop-ins continue to stay open during COVID. The need to have consistent, dedicated workforce to do this incredible work is still here. Staff turnover is high and job satisfaction is alarmingly low. It is incredibly difficult to do this work with so many funding cuts and depletion of resources. TDIN has been tracking the overdoses that drop-in staff are responding to since the closure of the SCSs, and they have increased significantly. Any frontline worker in a drop-in now has the expectation to respond to these overdoses. This is a skill as well as an event that can cause personal trauma both to the participant and the responder. Frontline workers can literally be responding to an overdose, serving lunch, and facilitating programming all in one day. Additionally, we are seeing an increase in people being released from hospitals to drop-ins. These are not overnight spaces and not appropriate spaces for people to recover. Workers are needing to spend time trying to find alternative shelter when shelters are almost non-existent and often have to facilitate returns to hospitals. These frontline workers are working in dire times, getting paid wages where they cannot effectively support themselves. If we were able to find the funding during COVID for what we recognize as an essential service, we can do it now. When I was a frontline worker at a downtown drop-in, I was amazed to see so many people working with second jobs and roommates just trying to cover their own basic needs. I've been back in the drop-in where I worked 3 years ago and cannot recognize most of the drop-in workers. Most staff have left. I would like to end with a quote from our research from a frontline drop-in worker. They said, If I were a firefighter, I'd be called a hero, but here we're seen as charity workers. I urge you to consider drop-ins the essential service that they are and increase funding to these programs so they can pay their staff a living wage.
Thank you so much, Marianne. Are there any questions? Marianne, thank you for sharing that with us today.
Thanks.